The definition of conviction is a firmly held belief. Leadership looks different for each person, but every leader has strong convictions that pave the way for how they guide their people. Whether you're an experienced leader, a current leader, a novice leader, or a soon-to-be leader, this podcast is a must for you. Through this show, you will hear leaders share their convictions, the struggles they face, and the challenges they have overcome by staying true to their convictions. Leadership can be hard and it can be lonely. I aim to connect you with leaders who have walked the journey and want to show others the way. This is Beau Vincent, and you're listening to The Conviction of a Leader. Welcome back to The Conviction of a Leader. This is Beau Vincent, your host, and I'm excited to have Melissa Goldsmith. Melissa, welcome to the show.
Thank you, Beau. It's good to be here.
Good. I'm so glad you could join us today. And before we start, I am going to make sure to introduce you to all the listeners out there because you are an extremely successful psychologist, and I can't wait for me to pick your brain, but also for you to share about leadership and entrepreneurship with all the listeners out there. So Melissa has been a licensed clinical psychologist for over 15 years. She specializes in individual treatment for PTSD. She has expertise in cognitive behavior therapy, cognitive processing therapy, and prolonged exposure therapy. She's the owner and licensed clinical psychologist at Melissa Goldsmith, PhD, LLC, in Solon, Ohio, and she just opened in June of 2024, which we'll dive more into the nuances and the excitement of opening your own business. I'm sure, and practice, I'm sure it has been exciting, but also I'm sure there's been some challenges.
Yeah.
She was a former clinical psychologist at Traumatic Stress Center, Summa Healthcare, Akron, Ohio, for 7 years. She has been a licensed psychologist in Ohio since 2016. She has a PhD and MS in clinical psychology from Florida State University, BA in psychology from Northwestern University. She pretty much has traveled around the eastern half of America for the majority of her career in learning. She has been all over. She has published works in psychology, trauma, and Journal of Psychiatric Research. And she has been married to Brian for 6 years, been with him for 9. They have a 2-year-old son, Luke. And in her free time, she does enjoy cooking, kettlebell workouts, and Big Ten football.
Yeah.
And I won't judge her because she loves Michigan and Northwestern football.
Yep.
Northwestern, I'm fine with, obviously, as
Yeah.
a Buckeye fan, which we just talked about that. That's okay. I won't hold that
Yeah.
against you.
Thanks.
We're going to have fun today anyways.
Yeah.
Melissa, did I miss anything as I introduced you to all the listeners out
No,
there?
that sums it up.
Wow. Very impressive. Congratulations on opening your first practice in June. Let's start there. Tell me about what that journey was like getting to opening your own practice in June, and how has it been?
It's been quite a journey. I will say that so prior to opening my private practice, I had worked at a specialty clinic and I absolutely loved what I did. I worked with civilians who were coming in for treatment for post-traumatic stress disorder. And
Wow.
for a lot of people, they were really surprised because they're like, well, you just work with veterans, right? And I'm like, no, no.
No?
Most individuals I saw were civilians who
Wow.
had gone through some pretty horrific things. And with the treatments that I used, you had mentioned cognitive processing therapy and prolonged exposure therapy. That, I would take people through these treatments and, they would see significant changes in their symptoms. And I really, really enjoyed that. And I had felt like kind of more recently that I was kind of ready to go out on my own. Um,
Oh, that's awesome.
and had felt like I had gotten just a really good foundation from, um, where I worked previously, and my colleagues were so supportive, and excited
That's
for me.
great.
And that one of the reasons I had wanted to go into private practice was honestly, outside of the VA, there aren't a lot of places where civilians can go for these particular treatments of cognitive processing
Wow.
therapy and prolonged exposure.
I did not know that.
Yeah.
Well, good for you.
So,
So you saw an opportunity that to help.
mhm,
I would imagine
yeah.
to help and to do more and maybe do a little more on your own terms too.
Yeah.
So I'm sure there's things when you work for businesses like I've had it to in the past or hospitals and health insurance. So all those little things that come along with health uh,
Mhm,
and insurance and all these traumatic problems. So I'm proud of you. I'm happy to hear.
mhm,
I'm happy to see that you stepped out on your own. I know it's not easy, but it's so rewarding, and
mhm,
the risk can be huge, but the reward I just love the reward and the reward I get, and I can only
mhm,
imagine as we'll talk about the rewards you get in fulfillment from helping others
mhm.
overcome some of the past struggles they've had or current struggles. So
Yeah.
wow, I love that. I'm
Yeah.
so happy for you. So that journey from leaving and then going, how long did you mess around with the idea or think about leaving and starting your own private practice?
Um, I would say it was something that was at the back of my mind kind of always.
Hmm.
I will say Brian, it was always on his mind
Hmm.
from the start. He had
Yes,
always wanted me to go into private practice. I
he's an entrepreneur.
Yeah,
Yeah.
absolutely, absolutely. I will say, kind of as the pandemic went on, I think that you know kind of thought got a little stronger for me,
Yeah.
just because the demand was so high,
Hmm.
um, and we just it was hard to keep up.
Yeah.
So,
I can imagine.
I will say, kind of after I had my son, things changed a little bit, and just
Hmm.
wanted to make some changes, and it felt like it was kind of the right time.
That's
So
awesome.
yeah.
I can't wait to dive into more of the leadership side and how
Hmm.
entrepreneurship, leadership side of uh, business side. Because now not only are you a psychologist, but you're a business owner too. So how has
Yeah.
that impacted one side or the other? What challenges have you run into?
Um, a lot already, actually.
Yeah.
So a webinar I saw a while ago was about basically for people like me opening their own private practice, and this idea of
Hmm.
this view of you are someone helping another person, but at the same
Yeah.
time, you're also managing the money piece. And
Oh
so
yeah.
many clinicians have that issue. It just, they clash so much. And so it's this idea of, I'm a psychologist and I'm a business owner. It can't be kind of one or the
Hmm.
other. And
Yeah.
kind of valuing the services that you provide.
Yeah. I totally understand and making sure that the quality never is impacted by the business side.
Hmm.
But at the same time, in order to continue to offer these services, you have to make sure the business side and the profitability and payments are collected, which I'm sure that's a totally different feeling. And yeah,
Yeah.
I'm
Yeah.
sure that is.
Yeah.
So the conviction is of a leader. The reason I started the podcast was to really dive into our deeply held beliefs that
Hmm.
we hold dearly to us as we lead our businesses. And
Hmm.
I sometimes I
Hmm.
haven't got it fully into this, Melissa, but at
Yeah.
some point in the future, I think all convictions. I'll also talk about the guilty side of convictions too. But
Hmm.
for this
Yeah.
case, it's the strongly held beliefs.
Hmm.
And could you share some convictions that have been pivotal
Hmm.
to your leadership and We'll start there.
Sure.
To your leadership. Yeah.
So I would say there are probably right now two main ones that come up.
Yeah.
The first one, my one of my supervisors on internship told me. Um, he worked at the Boston VA or National Center for PTSD. I should know this, but I'll never forget he told me that, our thoughts are thoughts, feel our feelings, and then do what we need to do anyway. That kind of
That's
sums up cognitive behavioral therapy. So, kind of,
I like
we
that.
have these thoughts, they may or may not be realistic, but because we have them, we think they often are. They may not be. Um, may have a lot of different emotions that come up. You know,
Oh yeah.
it's great when happiness comes up. We don't necessarily
Hmm.
question it, but when it's anything that's not happy, it's like, why am I feeling this way? Or I don't like this. But
Right.
approaching it from
That is
a,
so true.
hey, I'm noticing I'm feeling this. That's normal. It's because this
Hmm.
particular thing or these things are happening. And then I think the most important part is, yeah, we feel these feelings, but then we still got to do what we need to do anyway,
Right.
you know?
Still have to live, run
Um,
businesses,
mhm. So it
work.
maybe,
Yeah.
yeah, we feel like, for example, like after a long day of work, it's like, yeah, I really don't feel like going to the store. I'm just too exhausted. I just want to go straight home.
Yeah.
And it's like,
But I need to.
I need to get groceries. And I feel that way, but it's not physically going to stop me. It's more
Mm.
of a choice of, you know, I can't go versus I'm choosing not to go or I won't go.
Yeah. You know, I've talked to a lot of leaders, a ton of
Hmm.
leaders, and I'm so blessed to do that. But I would tell you some of the biggest challenges that leaders face are deciding to either ignore or pay attention to thoughts around things they can or can't control. And
Hmm.
sometimes they're confused on, and they make excuses on things that they can control that they can't. And then they maybe don't come to grips with things that they just can't control. And
Hmm.
how do you help leaders and people deal with
Hmm.
I guess
Yeah,
understanding what can they can control, what they can't?
right.
How do they balance that?
So that's actually kind of that whole topic is actually like one of the sessions that I do with individuals in cognitive
Mm.
processing therapy. It's all about control. So first thing I say is
Ooh,
control gives the uh, impression of it's either all or none. Either I have control or I don't at
mm,
all.
I like that. Okay.
And honestly, control is on a continuum.
Hmm.
And the word that kind of conveys that is the word influence. So maybe we've got
Mm.
like, I don't know, 70, 80, 90% influence, that's in with us. And then we've
Yeah,
got that other 10 to 30% that's external to us that we don't have influence over.
that's a great thought. I have not thought in that terms
Hmm.
ever. I always
Yeah.
think I either have control or I don't.
Yeah.
But that's such a different angle.
Yeah.
I love that.
And that's what CBT is. It's we're getting it
Yeah.
away from the extremes and kind of moving it to what's more nuanced and kind of recognizing what is actually in our influence.
When somebody realizes what's in their influence,
Hmm.
what kind of advice or thought processes are you walking them through or
Hmm.
angles to look at it
Yeah.
to help them grow?
A lot of different things.
It's probably a lot of different
Yeah.
for each person. Yes.
Yeah. It can be so, for example, in terms of kind of what we ourselves have control over just during the day. Like, think about
Yes.
how many things have you done since you got up this morning? How many
Yeah,
different
a
decisions
lot.
have you made?
I mean, a ton,
Yeah,
but subconsciously, right?
yeah,
Most of them.
yeah,
But there was a lot of conscious ones too.
exactly. And so
Huh.
that's where it's like we have influence over the decisions we make. But oftentimes
Right.
we may think, oh, that doesn't count because it's not a big it's not a big decision. Like,
Mm,
oh, am I going to get up and get out of bed? Am I going to eat breakfast? Am I going to brush my teeth? You know, all of
mhm.
that stuff. that we may
Wow.
often discount, and people often
Yeah.
focus on those big events and the decisions they make or that they didn't make,
Mm.
and come to views about how much control they may have or accountability based on those big decisions.
Yeah.
But
So a lot of little decisions
mhm,
can add up to one this big decisions, or we
yeah,
think we maybe are maybe somebody like me would say, I didn't realize all these little decisions have added up to what I would have thought
mhm,
was a big decision, but
yeah,
there's a bunch of little decisions that have gotten you here today.
yeah.
Okay. Do you do people take like into account or make notes about or journal about
Mhm,
their life to help you kind of like
mhm,
them pay more attention to the decisions
mhm.
they make? Like, do you have any advice or thoughts
Yeah,
around that?
yeah. So, what I would suggest in CBT, they have something called a thought monitoring log, or a
Hmm.
um, sometimes they'll call it a dysfunctional thoughts log, but just
Hmm.
basically kind of getting a sense of, okay, what event is happening, and what thought did you tell yourself, or what thought came up in that moment about it, and then how did you feel?
Yeah.
Now, for most of us, when we start out with stuff like that, we're like, I don't know what thought I had about it. I just felt really mad, or I felt really scared,
Hmm.
or I felt really sad. So it's okay and very normal to start with, well, I know the event that happened and I know how it made me feel. Let me then kind of fill in the blank of, you know, I'm thinking it was probably this thought, for example.
Yeah.
Um, so the example I always give with people when I'm explaining CBT is this idea of, let's say you are scheduled to go meet somebody for lunch at one
Hmm.
o'clock. Okay. And it's 1 o'clock, you're there, the other person's not. Okay. How might you be feeling? What might be going through your mind?
Where are they?
Hmm. Yeah.
I mean, are they okay? Or
Hmm.
why are they late? Maybe I would get a little frustrated, like I was here
Right.
and I have a busy day and I made it on time. I don't know.
Yeah.
Yeah. Just depends.
Yeah. Now imagine it's 15 minutes after or 30 minutes after.
Hmm.
What might somebody be thinking or feeling at that point?
Yeah.
You know?
I mean, especially if I haven't heard,
Hmm.
I could be worried about them.
Yeah.
It would probably turn from I was frustrated, now I'm worried
Hmm.
because can't get a hold of Melissa. And I called her office and now I'm calling her husband.
Right.
Hey, I haven't heard from, like, is everything okay?
Yeah. Yeah.
so, so yeah.
Yeah. And so when I explain that to people, I've gotten some of those very responses, like, I'm feeling scared, I'm feeling sad, I'm feeling angry, I'm feeling rejected. Um,
Right.
and oftentimes, those emotions that we're feeling in the moment are based on what thoughts are coming up in our mind. It could be, like you were saying, what if something happened? Did they get into an
Yeah.
accident? It could be,
Hmm.
if it's leading to feeling sad, oh, I guess they don't want to hang out with me. I guess they don't really like me. Or
Yep.
the rejection one of, yep, happen again. People don't like
Mm.
me. Or the anger
Yeah.
of, that jerk. How dare
Yes.
they?
Oh,
Yeah,
never again.
yeah. But basically,
Yeah.
this idea of looking at what's the event that's going on,
Hmm.
it may help to kind of initially identify the emotion or the emotions first. And then
Okay.
what was maybe the thought that connected the event and the emotion together?
Oh, yeah.
And
That's
that's
great.
where we can have a lot of different thoughts that come up and a lot of different emotions that
Hmm.
come up.
Yeah. I mean, so just like in my own self, like
Hmm.
sometimes I think about I've had I wouldn't say I did not I had a great childhood, but I think like as an adult,
Hmm.
I would say around 16, 17, my dad started struggling with
Hmm.
multitude of things and
Yeah.
it led to him failing in business and eventually going to prison and having
Hmm.
some other things. But I was the oldest at
Yeah.
that time. My siblings were much younger, so I often think I used to identify, oh, my dad would reach out and he would say he was going to do something as an adult and he'd never show up.
Mhm.
But 3 days later, I would feel like anxious or mad or devalue myself. And I started to
Mhm.
recognize that, wow,
Yeah.
every couple days or day after he tends to let me down, I struggle with myself,
Mhm.
my emotions, controlling them,
Yep.
whether happiness, sadness, and you know what I learned, Melissa, over the last couple of years is that because I've embraced it more, is that I actually realize, wow, I'm extremely happy and sad a lot sometimes,
Mhm.
and they're
Yeah.
they're not exclusive. They can live together. And I used to think like
Yep.
when you're sad,
Mhm.
but there is a way to have a lot of happiness and then a little bit of sadness also
Yeah.
layered in there too.
Yeah.
So,
Yeah, that's so true. It, the emotions don't have to be exclusive. So, like, if you've
hmm
seen Inside Out, that's one of my favorite
hmm
recommendations to give to clients when they're like,
I love that.
nope, don't want to feel anything, or if I feel this, it's going to be too much. It's, you know, if we're going to feel, we got to feel all the emotions. We can't cherry pick. I wish we could,
Ooh,
but we can't.
yeah, it's
And
true.
kind of each emotion serves a function or a purpose, much
Right,
as we may not like it. But if we
right.
let the emotions run their course,
hmm
they do eventually kind of die down.
And what happens
Yeah.
when you don't let them and you push
When
them
you push them
away,
down,
ignore them?
that's when the problems come up.
Mhm.
That's when
Mm.
things like, if we're pushing out fear, sadness, anger, even feelings of happiness, I have
Yeah,
seen happen.
like you don't deserve. Yeah, I don't deserve to be happy,
Yep.
or I need to ignore that.
Yep. When those get
Slow me
pushed
down.
out, that's when we get a lot of the problems. That's when we often see a lot of guilt, shame, pride, disgust come up. And that's where we see, I guess, what we would call unhealthy coping strategies. So
Yeah,
it might be people turning to substances, turning
yeah,
to um,
drinking
self harm. I
or
mean, you name
substance.
it.
Yeah,
Yeah.
Mm. Yeah. What advice do you have to help leaders who tend to take on other people's problems that they can or can't control,
Yeah.
and they kind of force their self
Hmm.
into solve? Melissa works for me and she has this problem. I need to solve it,
Hmm.
and if she's not solving it, and now becomes stressor on me.
Hmm.
So, what kind of advice do you have for leaders and business owners that take
Yeah.
on customers, because you have patients,
Hmm.
customers
Yeah.
take on their, but you also take on, employees and
Yeah.
the business stress? Like, where do you draw the line? How do you decide
Yeah.
what not to take on, what
There's
what to?
there's a lot, I would
So
say.
such a deep question.
No,
Yeah, a lot of answers to
but
that. Yeah.
I think it's really important, especially for the field that I'm in, that people are clear on that view. One
Yeah.
is you recognize what you yourself can do within reason, like know your limits,
Okay.
know your boundaries. There's also the saying, not my circus, not my monkeys. And I
Yep.
love that because it's a fun way to say, here's my boundary. Like,
Mm.
here's what's mine, here's
Yeah.
what's in my influence that I can do, and here's what's not with that.
Oh, it's good.
And kind of recognizing, okay, well, that's something that they're, you know, is on them. Maybe they're trying to push it on me, but that's not my job to solve it for them. My
Yeah.
job is to give them the skills. Their job is to practice those skills consistently.
Yeah. As a business owner and a psychologist,
Mhm.
how do you balance your work life integration, work life balance,
Yeah,
after, like, you're running a business,
yeah,
you're a psychologist, you have patients.
yeah.
Um, let's talk about that, but
Sure.
also when you really hear something very traumatic, how are you able to go home and
Mhm.
be like, oh, da, 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 let me just make dinner and get over it? Like, is that
Yeah.
something you learned? Does it still pop up from time to time where you're like, I can't believe they had to go through this? Like, or I don't know. Has that
Yeah.
ever happened to you?
Yeah. I will say there are times here and there where it'll pop up.
Mhm.
Um, but there is something where you kind of do actually just get used to it,
Yeah. Like,
kind of hearing the details. But I think that's
mhm.
also where, too, with the treatments that I do with CPT and prolonged exposure, they're short term and they're focused on building skills so that the other person learns them to the point where they can take it and do it on their own. So, in that way, I think it helps reduce potential burnout on my end and helps maintain that, hey, I can keep showing up as I want to for work with that.
Wow.
But I will say downtime, any sort of out of work time is sacred for me because it really is where I have to restore. Um, and like you had mentioned, kettlebell workouts, I love those because
Nice.
they are very efficient and effective and just help
Mhm.
me get
They
some of
are.
that energy out, you know. Um, you know, yes, I'm a psychologist, I'm a business owner, I'm a human, I'm not a robot.
Hmm.
Like,
And a mother and a
yeah,
wife and
yeah,
a friend and everything else that comes along in your
yeah,
life, right?
yeah.
I was going to ask you, I'm like, what do you do to restore? And you said kettlebells and
Hmm.
to kind of find that balance. And
Hmm.
so I appreciate you sharing that.
Yeah.
What else have you?
Well, Big Ten football, so I love fall
Yes.
season.
Oh,
Yeah,
I can't wait.
I love it. So the Ohio State Michigan game is always my favorite.
Mm,
Even
I'm
though
sure.
I root for Northwestern.
Divided household.
Yeah, it is.
Yes.
Although I will say I was at the game when Northwestern beat Ohio State in Evanston, and that was
Wow.
amazing.
Well, it was for you.
I know, I know. It
Yeah.
was great.
No, that's awesome. Great school though.
Yeah,
Like from academics and athletics.
yeah.
It's a fun school.
But
So no shade there.
yeah.
So I get that. What have you learned from leadership psychology?
Hmm.
What attributes do leaders tend to maybe have like
Hmm.
that some because I would say not everybody's a leader.
Yeah.
So what kind of attributes, coping mechanisms, skills have you
Hmm.
noticed that leaders have or have developed?
Yeah. Well, I would say um, one is definitely kind of flexibility in
Mhm.
terms of just openness to trying different things or considering different views. Um,
Mm.
my honors thesis advisor, my senior year of college, was Dr. Jennifer Richardson. She's amazing. And she would always say, with um, collecting data for research studies, she's like, the data are the data. And we just kind of have to explain it from there. It's
Mm.
what do they show us, not kind of what particular thing are we trying to make it show.
Yeah, I see.
Um, Trying to think what else. Um, I would also say kind of that ability to not only see the big picture, but also the details. So there's a saying in
Yeah.
psychology of seeing the forest through the trees.
Yeah, I hear that quite often.
Yeah.
Yes.
So I think being able to balance both of those is super important. And I remember Dr. Richardson was awesome at that.
Oh,
Um,
that's awesome.
she's great. And then I would also say too, the ability to kind of not only balance like the emotion piece in business and
Mhm.
psychology, but also the logic piece. Because there are
Yeah.
times where we've got to be more of one or the other, but then also times where it's got to be the combination with it and kind of
Oh yeah.
figuring out what is the situation demand or what's the need with it that's going to help us most.
Great.
But yeah.
Well, that those are some great attributes. Um, so I know leadership
Hmm.
and ownership, entrepreneurship can be lonely
Hmm.
at times. So have you felt alone a little bit in this process over the last couple months? And what have you done to cope with
Yeah.
that?
Uh, I will say it has been different because I
Hmm.
now, so you can see this is actually my office.
Yeah.
I, um, where I worked previously, like my colleagues were just in the hallway in the other rooms. And, we would pop in and kind of like, hey, you want to go to lunch? Or, hey, I need to
Yes.
consult on a case. And I don't have that now, which I miss a lot, you know?
Oh, yeah.
Um,
I do understand
and
that.
just kind of realizing how important that was in also kind of decompressing. But
Mm,
I would say that kind of since being on my own, definitely still texting a lot with them to keep in touch.
yeah.
Because there were definitely ones too where we bonded over being moms. There
Mm,
was actually at the trauma center in 2022, I think there were definitely two of us, maybe three, who had kids. So there was almost a joke like, is there something in the water here? But, now we still
nice.
keep in touch of like,
Oh,
hey, my kid's doing this, here's what you might
yeah.
see a few months down the road. And just getting together for play dates and things like that.
Yeah, I think it's great to interact with other people in your field
Hmm.
or industry. I think it's hugely important. It is kind of like a hack into the ownership and entrepreneurship is to find
Yeah.
people that are doing similar things to you, whether they are in front of you, behind you, beside you, as far
Hmm.
as their career and how long they've done it.
Yeah.
I think as an insurance agency owner, I've only been doing it for 4.8 months. So
Hmm.
you think there's an opportunity I could have, or I guess there's a chance, even though I'm a talker, there
Hmm.
is a chance I could have just focused internally with just the office and just the employees. And
Hmm.
I'm not so sure I'd be in the position I am today because I went out and I networked with people that did it very well. And
Yep.
just like this podcast, asking people to share their journey. What have you done well? What have you learned? What could I learn from your journey? And maybe I don't have
Hmm.
to fail on the same things that you failed, or maybe I don't have to fail for 4 years. It'll take
Hmm.
me 4 years versus 40 years. So
Right.
I've learned going out to these conferences, and then I had a consultant for an amount of time, and then I became a consultant, and now I consult others. And I think having
Hmm.
somebody that can help you find the way in business is
Definitely.
so huge, and
Yeah.
also just friends too within the industry,
Hmm.
not just somebody you just enjoy their
Definitely.
conversation.
Yeah. And I've, just asked, different people like what helped you in kind of launching your private practice. Because different friends of mine, have been in private practice for a while and they have consistently said, just meet with other providers for coffee, meet with them for lunch, talk
Yeah.
to them about, you know, what they're doing in their practice. And so that's what I've been doing. It's been really cool. Um,
Oh, that's great.
so talking to different psychologists, different psychiatrists, actually been talking with a lot of pelvic floor therapists um, who
Okay.
see
Yeah.
kind of the effects of some traumatic experiences, unfortunately.
Oh, yeah. Okay.
So,
I understand.
um, but it's been really awesome and just kind of seeing um, people talk about kind of their journey of, I guess, particularly within healthcare. Many
Yeah.
individuals I talked to had initially a practice where they accepted insurance. And then, kind of over time, whether or not they continued to accept health insurance and kind of the pros and cons with that.
Hmm.
So,
Yeah. Being able to rely on other people that are doing it and have done it is huge.
mhm,
I'm sure you'll find a lot of support there because
yeah.
is it a very competitive industry where they don't want to share what they're doing, or do people seem to be relatively open?
I would say everybody I've talked to has been pretty open and more like, hey, there's more than enough to go around. Um,
Yeah.
Different books I have read have definitely talked about this like scarcity mindset of, hey, I've got to keep this person. And I'm
Yeah.
like, no. Um, I know from the wait lists that are going on for different places, like there are not enough providers,
Hmm.
you know?
That's sad. Yeah.
So, and I
In
think,
in the future. Oh, no,
oh,
go ahead. I'm
sorry, I was
sorry.
just going to say, and I think like prior to the pandemic, there were definitely wait lists. And then the pandemic
Mhm.
just, it went to a whole other level with it.
Wow. Do you think in the future that you will have other doctors that you will bring alongside you? What does the future look like for your practice?
So that's something I'm still kind of debating. I
Yeah.
think at this point, um, just focusing on, getting established, and just really being able to provide the care, that
Yeah.
quality level of care that I want to. Um, and I think maybe as I get more acclimated into the business, I might look into that. But yeah, think just kind of
Yeah.
focused on this for now. Yeah.
Oh, I totally understand. Do you have any support roles that you think you would add someday, as far as like, oh, or do you have a
Hmm.
support person, employee,
Nope.
team member? You think
It
that would be a opportunity in the future too?
it it could be. Yeah.
Yeah.
I will say,
Kind of loosen up the business side from you, so you a little bit.
yeah, or marketing.
Yes.
Because that is basically what I've been doing mostly since I
Mm,
opened. I have been
wow.
seeing some patients, but yeah, just kind of getting the word out
Getting the
there.
word.
Um,
Wow.
so yeah.
Well, I would totally agree. And in the world we live in is like, where, I guess, where is your customer, where are your patients, and how do you market to them to just let
Mhm,
them know you see them?
mhm,
Because have you ever heard the know, like, and trust for marketing? They need to
mhm.
know you is the first thing,
Uh,
is for
yeah.
marketing. They just need to
Mhm,
know where you are, what you do.
mhm.
Then they decide if they like you.
Yep.
And then if they trust you, they will give you their money. So, and they will work with you. So I think marketing is getting the word out there, because no one will ever work with you if they don't know who you are. They don't
Mhm.
know who you are, but once they get to know you, then they will decide if they like you. So yeah,
Exactly.
marketing is so important nowadays, especially because you're outside of a hospital system now. So
Yeah.
you're separate. And how do you get the word out? Like, what kind of marketing are you doing now?
Yeah. Well, I would say like the meeting with other providers, that is a big
Uh-huh.
way,
Mm.
for marketing.
Like referral, almost like partnerships. Yeah. I
Exactly.
like that.
Yeah.
Mhm.
Um,
Those are huge for our industry too.
yeah. So other psychologists, psychiatrists, primary care. I've been talking actually with a lot of concierge physicians,
Mm.
um, because they, kind of like me, are usually it's usually just them or kind of one other support person helping,
Mhm.
um, but wanting to provide that high level of care with it. And they also, too, typically have some sort of, subscription based kind of plan with
Oh, I
it. So
see.
they don't take
Mm.
insurance. They still advise people to keep it, in case something catastrophic happens. But um, so yeah, I would say a lot of networking. Um,
Oh yeah.
the website design. So that was a
Mhm.
DIY of mine. um, and
Good.
that was just a labor of love for several months earlier this year, and
Wow.
launched it. I do actually have somebody who's going to be kind of revamping and updating it to just help it
Mhm.
speak even more to those
Wow.
people who I think it could
Great.
connect with. Um,
Wow.
and then hopefully some social media stuff. But
Right.
yeah.
Social media is obviously one of the biggest, whether it's, I think podcasting feeds into our social media for coaching, consulting, insurance.
Hmm.
The podcast kind of just, it's free worth to help other people. One,
Yeah.
two, it also feeds into our social side of the business, but also, yeah, running a consistent Facebook account,
Hmm.
Instagram. Some people get into TikTok. Obviously, we have YouTube.
Yeah.
So all those, but then you can run ads, you could do reels, you could,
Hmm.
give out advice. I wonder what it would be like, could a psychologist
Hmm.
do reels or TikToks? And do you put yourself
Mhm.
in a position of like liability or no? Can you give basic
So
advice,
that's
publicly speaking?
yeah, so that's a good question. I think we can generally talk about, you know, certain topics without providing any
Yeah.
sort of identifying information.
Hmm.
But I know, like, um, we can't say, oh, this person experiencing these symptoms. Like, no,
Hmm.
that totally
It's
breaks
too much.
confidentiality.
Yeah.
Um,
Yeah.
and what's interesting too, and I've run into this a little bit with social media stuff, just in talking with different social media companies, is like we as psychologists cannot solicit testimonials.
Mm.
We also cannot respond to any reviews online of us, good or bad, because we
Wow.
cannot confirm or deny who our clients are.
Ooh.
Yeah,
I did not realize that.
yeah,
That is a lot.
yeah,
That's also a little bit of a stressor, when you think about like,
yeah,
okay, I just know you know what you can or can't do, which makes sense. So yeah, that could remove some of that. But yeah, I didn't. That's a challenge when
yeah,
it comes to trying to grow that area.
yeah,
Ooh, that's different. I never really thought about that. Yeah,
yeah.
saying, oh, Brian, you were so awesome, or whatever. I appreciate it.
Mhm.
Yeah, then you're confirming that they were a patient. Ah, I get that.
Exactly. Yeah. Or
Wow.
it would come up kind of more commonly, um, like let's say if somebody who supposedly knows us, that knows the clients, um, is calling the office and saying, "Hey, I want to give this information on so and so that I'm seeing."
Mm,
And if the client has not signed a written release saying, hey, it's okay to talk to this person about my care or these things, we have to say we can't confirm or deny this person being
mm.
a patient here.
Yeah, that is. Yeah, I could see why you couldn't
Yeah.
do that. If okay,
Yeah.
wow. So if I called up though, like and said, hey, you can talk to this doctor, or do you need a written,
Hmm.
like a signature,
Hmm.
or verbally can I give advice or tell you you can?
Hmm. So it would be something like, you can say, hey, I want to provide information on this person. You
Mm,
may or may not have a release of information, but I just want to provide this. But yeah,
wow.
so it's been interesting, and I've heard this from a lot of my colleagues who are in private practice, where um, trying to have some of the approaches with psychology fit with the business
Hmm.
piece and kind of how we can make it
Yeah,
that way.
yeah, that makes sense.
And so I think even more the leadership piece really comes in.
Yeah, of course. Speaking of leadership, what has maybe been a common misconception that have you dealt with leaders in your practice and
Mhm.
about maybe some misconceptions about what leadership is or what leadership needs to be in helping people see that,
Mhm.
hey, maybe that was a misconception that you've learned
Mhm.
along the way, but this isn't
Yeah.
really something you have to do as a leader.
Yeah.
Uh,
Well, I will actually say one is the idea of like leaders have to be very extroverted. I will
mm,
say personally, that is not me. um,
yeah.
I am much more introverted. Um, and I remember one of my internship supervisors had said, like, that I have a quiet confidence. And I
Mm,
thought that was a really
I
great
like
way to
that.
phrase it,
It's a great compliment
you
too.
know? Um, and more of just this idea of being able to listen and hear what people are saying is so
Mm,
important, because then you're going to be that much more effective as a leader.
it's true. Yeah, that has been a challenge of mine over the years, and I've gotten better.
Mhm.
But it's, yeah, to understand versus just want to respond or share my story, and understanding what people say. Like, I've also learned as a leader is that, my team and customers just want to be heard. They
Mhm.
know I can't change and do everything. They already know that
Yeah.
they're asking, but sometimes they just want to be heard. And
Mhm.
I just need to open my ear and close my mouth, and I've worked harder on that. And then to respond in a sense of like, so what I understand
Mhm.
is you feel this way, and
Mhm.
you're asking for this. Is that correct? And so just being a little more patient, because as a fast-paced person who
Mhm.
um, is wanting to get to the point some days, that also feels not as genuine to rush
Yeah.
people. Hey, just get to the point.
Mhm.
Like,
Right.
what are you trying to say?
Right.
What do you want? You want more money? Just tell me. Like, so,
Right.
but not to shorten that conversation, because we do build a rapport and a trust by allowing those that are on our team to just speak and listen,
Mhm.
to understand. I love that. That's good
Yeah.
advice. Good advice. Um, so, what kind of advice from your
Mhm.
experiences would you give your younger self? What would you tell yourself?
Oh man.
Younger version. It could be back in school. It could be
Mhm.
when you were just
Yeah.
starting into the training. So
Yeah.
I would love to hear, what kind of advice would you give yourself?
For one, I would say just keep going.
Mm,
Like,
yeah,
just stick with it because it doesn't have to be perfect. Just keep
right.
doing it. I will say I that has been something since before undergrad that I've been doing. Whether it was, hey, I'm trying to get into Northwestern, or I'm trying to get into grad school or internship or whatever. It was that very much just do what I can do, just focus on what's in my influence and do everything I can towards that to maximize my chances of a good outcome with it.
Nice. Do you think some people get stuck wanting things to be perfect before they move forward or take a chance and
Yep.
perfect timing?
Yep.
How did you get
Yeah.
past all that?
Uh, well,
Yeah.
very stubborn, but I will never
Yeah.
forget. There was actually, I think it was 60 Minutes did a segment on Facebook when they were like
Hmm.
10 years old. So I'm clearly dating
Wow.
myself.
Wow.
Um, yeah.
I know what year that would be. Yeah, definitely.
Um, but I will never forget in that segment, they had shown a sign that was on the wall on Facebook, and I had never heard this statement before, but it said, "Done is better than perfect."
Mm, I like
And
that.
I loved that saying. And
Done is better than perfect.
yep,
Mm, like that.
I tell myself that all the time when
Write it
I'm
down.
finishing up notes for sessions because it's like, oh, I need to make sure, I include, this aspect of it or that. And it's like, no, just get the gist of it, get it done. And
That's good.
I've told so many patients that, and they've loved it.
I just wrote it down.
Yeah.
I love one-liners that
Mm-hmm.
pack a whole lot of meaning.
Yeah.
I could put that into a million things,
Mm-hmm.
right? Teaching my kids to get things done,
Exactly.
right?
Exactly. Yeah. And that's honestly, that's what CBT is about is let's
Mm,
come up with a realistic, helpful statement, and
yeah.
oftentimes just those one-liners can be really effective.
Huh. I have a book of one-liners. I
Hmm.
call it that, and it has gotten huge because it's things that I attach onto for either periods of times or short period of time that I
Hmm.
repeat often
Hmm.
to myself, to other people. And this is probably one, because I also coach like a high-level baseball team now, and I think
Hmm.
like, hey, getting it done is better than perfect. So,
Yeah.
or wait, well, let me wait. Done is better than perfect.
Yep.
Okay,
Yeah.
just making sure I say it correctly.
Yeah.
Yeah, I like it. I really do like
Yeah.
that.
I think that, and then also like that idea of I can't control outcomes, but I can influence
Mhm.
probabilities.
Okay, I like that one too.
Like I said,
I
it's
like them
I'm
both.
going to do
Yeah.
everything I can to try to maximize the likelihood of getting the outcome I want. Now, that doesn't mean I'm going to get the outcome I want, which
Right.
can be tough, you know,
Oh, yeah.
because, it can make it feel like, oh, yeah, it's going to happen. It's going to happen. No, there's still external influences that can change the
Right.
outcome, even when we have done things perfectly. And that's
Oh, yeah.
sometimes the hardest.
Of course. I was listening to a book this morning, and the gist of it was a farmer could do everything perfect and still not have a harvest. Or
Yeah.
in external factors, rain, weather, soil,
Yeah.
no matter what they do, something could negatively impact it. The harvest is
Yeah.
really not up to them. It's kind of left up to things they can't control. But
Yeah.
their probability of having a great harvest by their hard work and the tilling and the seeds they use and when they do it and did they do it early enough, and
Right.
so but they can't control the weather, they can't control
Hmm.
temperature, they can't control the rain. So yeah, there's a lot of those things. They can't control
Hmm.
exactly how the soil will respond. So yeah,
Yeah.
it's
Yeah.
great.
And I
It's
think
great.
that way, then, too, oftentimes, then kind of after the fact, when people start to think about, oh, okay, let me review what I did or didn't do, it's, hey, I know I did everything I could, not the, oh, I
Yeah,
could have done this better, or I should have done that.
I think the guilt or the regret that I have after something didn't go well is really based on my effort that I put into it. Did I
Hmm.
do everything I could,
Yeah.
like you said, to affect the probability of it happening? It
Yeah.
just didn't. It just wasn't meant to be, is how I tend to lean on. Is like,
Yeah.
I did everything I could, or we did everything we could.
Right.
Could we have done things a little bit better or perfect that we didn't do?
Right.
But we got it done, and we did everything we could.
Hmm.
And at the time we had, the resources we had, and it didn't work out, but we did our best.
Exactly.
So
And I think
as
what you had just said about I did everything I could at the time, kind of with the knowledge I had, with the resources I had. That is a
yeah,
very, very important part of just in working with um, people in kind of working through traumas that they've been through. Because they're like, well, why didn't I do this? I should have done that. What were your
oh,
options? Traumas, there's never a win option. It's usually a menu of terrible options, and it's going with the one that is the least terrible.
wow, yeah,
And
those are
so
very
it's
true.
at that time you went with the best decision, even though maybe you didn't have all the information. But at that point, it was just about survival
Yeah,
and just getting
wow,
through. Yeah.
jeez, yeah.
My bad. Didn't
I
mean
know
to
we
take it
could.
a little too deep.
No, deep is I this we get pretty deep a lot on a lot of the podcasts. This is obviously a different angle from some of the other ones we've had in the past, just
Hmm.
with industry, but also I enjoy learning more of the psychology side, and just hearing your opinion, and also for myself, but also
Hmm.
for a lot of people out there. And I think that it's almost like a pandemic with the amount of people that have traumatic experiences now that they need to deal with, and
Hmm.
how they deal with them. And yeah, so let's talk about
Yeah.
you, and then we're gonna wrap before we wrap up.
Okay.
So for your own personal development,
Yeah.
what are you doing to grow yourself?
I would say one is trying to stick to the work life, trying to,
Hmm.
keep work at work. Still working on
Yeah.
that.
Yep. It's a
Um,
constant battle.
but also, I love reading audiobooks. Reading
Me
an
too.
actual book right now with a 2.5-year-old just doesn't happen.
So hard.
But yeah, the book I just finished was called Rejection Proof. Um, it was super
Oh,
interesting, and very
yeah.
timely. John Kuss, I don't know if
Rejection
you,
proof. Well, yeah,
yeah,
yeah. I know John.
yeah. He
Yes.
told me about the book. He was like, you need to read this.
He's he always has great recommendations
Yeah.
when it comes to
And
books, and he's awesome.
yeah,
Yeah.
it was exactly what I needed. Um,
Oh. Good.
It talked about just the idea of kind of dealing with being told no.
Mm.
Um, and this idea of it doesn't have to be something personal. It can be more about the circumstances of the situation. Maybe it's, hey, maybe they don't need it, but they know somebody who might, you know, need what the person's offering. Um,
Oh,
yeah. And I love the way the author, um, really honestly, he kind of systematically tested out different aspects of this idea of rejection and, um, looking at different factors of it, like, hey, if I up the ante in this way, um, and it honestly reminded me of, so there's something called cognitive behavioral therapy, for group setting
hmm.
for social anxiety disorder. And that is
Wow.
basically what this author did in his experience of rejection proof. So it was, he had sought out 100 days of rejection with some
Hmm.
outlandish scenarios, but it was such a
Just
learning
for the, yeah.
experience. Um,
Wow.
and so, yeah, I think just the knowledge that I learned from that just kind of helped continue to propel me to, continue with the marketing because this is
Good.
totally out of my element.
Oh,
um,
yeah.
and n- like nothing I've ever done before. But yeah,
That's true.
um,
Yeah, rejection in business is because like it's a little bit different from the psychology patient relationship is now a
mhm,
relationship marketing to people, and a lot of it is indirectly marketing. You're
mhm,
not directly marketing
right,
to you don't know a patient that needs your help, and you're not sending them a mail or an email
right,
and soliciting.
right,
It's a lot different.
yeah,
Yeah, it's like you're blasting it out that I'm here to
mhm,
help, and yeah, there you don't get the personal no's directly as much, but just in a big way,
right,
spend money, put it out, and to feel that, yeah, it is good to. I think the best leaders have faced rejection and learned to overcome it, and they teach others
yeah,
how to overcome and problem solve for themselves. Because I always talk about leadership, and we'll end here in a couple minutes, but
mhm,
as we wrap up, I
yeah,
always think about leadership as a choice and not
mhm,
a title. And I think a lot of us
yeah,
associate our leadership to a authority title, but
mhm,
leadership at the end of the day is really just helping other people become greater leaders themselves and overcome their
mhm,
own problems. And I talk a lot
yeah,
about, and you maybe you would love this. I talk
yeah,
a lot about leaders being doctors
mhm,
and being like a doctor
mhm,
and like a carpenter,
mhm,
because doctors are seeking to diagnose and give a correct treatment,
yeah,
where we have a lot of leaders that assume they know,
mhm,
they don't ask the right questions,
yeah,
and they give the wrong treatment, and then they blame the patient
yep,
or their employee
yep,
for not getting better or fixing the problem, but they misdiagnosed it
yep,
by not asking the right questions.
yeah,
And that's a big problem
yeah,
in leadership across. And you could probably think of some great leaders, but also some of the ones that weren't so great
mhm,
assume they knew the problem
yeah,
and gave the incorrect treatment or
exactly,
training.
yeah,
And
exactly,
and the other side of leadership is, I think, like carpenters.
mhm,
We should be described not based on our own tools, but based on what we build and
mhm,
what we help build.
right,
So, as a leader, if we are helping solve problems and people are growing from themselves,
mhm,
learning to solve it, and us not being Bo's a great leader because he communicates great. No, Bo's a
yeah,
great leader because he's created great leaders.
yeah,
Look at what the business he's built. So, what were you going to add? I didn't
exactly.
mean to cut you off.
No, you're good. I would completely agree with all of that. I think, yeah, we can provide these treatments. They may be really good, but if we don't have an accurate assessment, it's
Yeah.
not going to help.
Mm-mm.
And so that's where I think, too, it's that balance of, like I will tell the patient, hey, I'm the expert on providing the treatment, but you are the expert on you. I need you to tell
Yeah.
me, about X, Y, or Z symptoms. and I only can help as much as you tell me
Mm,
about with
it's
that.
true. Right.
And
If you're holding back something
mhm,
and not being honest and being dishonest. And that's why if you assume,
yeah,
and they could be holding back
mhm,
some critical information, they know. Because I've always said if a leader's like, Melissa,
mhm,
I know your problem.
yeah,
If they respect you, they could agree, one.
mhm,
But what if they're also like, what they're assuming is actually not as bad as what really
right,
the truth is? So
yeah,
I'll let them assume that, then know the truth of what's deeper. And sometimes
mhm,
for leaders, it could just be your team member is lazy and
mhm,
you're assuming it's something different, but they're not working as hard as maybe you think, and you
yeah,
assume, but if you ask enough questions, they may eventually say, honestly, I work remote and
yeah,
I end up like getting pulled into laundry and dishes and
yeah,
cleaning the house and watching TV, and now my kids are home. So there's challenges, but if they were honest with them, you could help them overcome it. But if not, you'll never know,
mhm,
and eventually they won't work for you, or they'll be just a percentage lower of a person that they could be
mhm,
within your business
yeah,
or organization. So,
yeah,
yeah, I want to make sure that all the listeners know because we have a huge
mhm.
percent, almost 50% are Ohio
Oh,
listeners,
wow,
but
okay,
we have the other 50% are all over America.
mhm,
So, in the past, and I say this like all the listeners out there, I want to thank you because
mhm.
over the past couple months since we relaunched season 2 of The Conviction of a Leader, we had a week where we had like I think 2 or 3,000 listens in a week. So
Oh my
and then
gosh,
we'll go down to a couple hundred. So
mhm,
it just depends on the guest and the listeners and whatever. But I want to
yeah,
make sure that all listeners know
mhm,
how to get a hold of you
yeah,
if they feel like they oh, you've got to know her and maybe you like
mhm,
her now, you trust her and you want to reach out to her. Do you
mhm,
do uh,
mhm.
uh what would you call that,
Telehealth,
telehealth? What do
mhm,
you
yeah,
telehealth and in person, and
I
how can they
do.
find you and reach out to you?
Yeah. So I do in person and telehealth sessions. Now, for telehealth, I can only do it for those who are actually in Ohio, where I'm licensed.
Okay.
But you can contact me through email. It's mgoldsmith at hush.com. So that hush.com is actually an email for healthcare providers.
Okay.
Um,
Oh, nice.
there's also my website, uh, melissagoldsmithphd.org. I've got a link in the website where people can click and it connects right to my appointment scheduler too.
Oh, great.
Yeah.
Well, we will make sure to add that to the show notes so that anybody listening that would like to either thank Melissa,
Mhm.
speak with Melissa, reach out to Melissa, you're going to have all the information in the show notes. So make sure to look below, check YouTube. There'll be links in any podcast platform you listen to. Do me a favor, like, subscribe, and share with your friends and family if you think this is going to make an impact on them. Melissa, thank you for joining the Conviction of a
Yeah.
Leader.
Thank you, Beau. It was awesome.
Oh, I really appreciate you stopping through.
Mhm.
Thanks. Bye bye.
Bye.